In this lesson, I'm going to be explaining some of the antepartum testing in detail and when each one is used. So to start, there are many routine diagnostic exams that are going to be done throughout the pregnancy, just at different stages. Pregnancies are all different and dynamic. So this just means that no two pregnancies are the same because they're all different. So a woman could be in her third pregnancy and undergone different testing in each pregnancy. Our goal is to properly screen, then detect any issues and address it if there are some. So just think of it as prophylactic. We are prophylactically looking for things and then going to treat them if they're there. We want our testing to be the least invasive first, whatever it may be, and then go to non-invasive, and then go to invasive if we need to, because we want to cause no harm. So the least invasive first. So let's talk about some of this routine testing. So all the testing I'm going to go over, this is certainly not all of it, just some of it. So refer to the outline and they are covered in a lot more detail. So for our routine testing, this is going to be testing that's done for everybody. So first we have rubella and Hep B. This is just lab work that's done. We want the mom to be rubella immune. So we're looking for either immune or non-immune. And then Hep B, we want her to be Hep B negative so that if she's not, we can properly treat the baby when it's born. Rubella. So this is going to be important for testing purposes. If the mom is non-immune, she will need a vaccine. Okay, but the vaccine cannot be given until after the baby is born. This vaccine is live, and so it can cross the placenta and harm the baby. So we want it to be given after the baby. No live vaccines to a pregnant patient. Next, we have STI testing. So with STI testing, these are just a few of the ones that we're looking at: HIV, syphilis, HPV, herpes, gonorrhea, chlamydia. So we will just do standard STI testing if something is seen, but also some of these are just done regardless. So this is just looking to see if there's something so we can treat mom or treat baby after they're born. Our glucose challenge. So this is done at 28 weeks for every patient, and they are going to have an oral glucose tolerance test. They drink something called glucola, which is just pretty much pure sugar, and then their blood sugars are checked. So let's first talk about the 1 hour. So the 1 hour glucola, the patient comes in and she drinks 50 grams of the glucola, and then she is checked an hour later, her blood sugar. If whatever the range is given in your book or class, go by that range. So let's say our range is 130 to 140. If she is above the 140 mark, then she fails. If she passes, then she's done. So only if she fails, then she'll get one more chance with a 3 hour. So at the 3 hour, she comes in and she's going to have a fasting glucose taken, fasting blood glucose, and then she's going to drink 100 grams of glucola, and then she's going to have a blood sugar checked at 1 hour, 2 hour, and 3 hours. If she fails two or more of these at each range, if she fails two or more, then that's a fail. So she's allowed to fail 1 to none. So 2 or more is a fail, and she's considered gestational diabetic. Some other routine testing we'll talk about is a urinalysis. So a urinalysis is done at each appointment to check for glucose, protein, and bacteria so that we can do further things if needed or treat the patient with antibiotics. The non-stress test. So this one, we want to see a reactive result, and this is going to look at the fetal heart rate. So think about when you move, when you run up the steps, your heart rate goes up, right? So this is to look at fetal heart rate, and it increases with movement. So the mom will be positioned and have contractions monitored as well as the fetal heart rate. And the mom's going to hit a button anytime she feels that fetal movement. We want to see the heart rate on the fetus rise with each movement. So this test is going to be, we want to see the fetal heart rate go up 15 beats per minute. So if the baseline heart rate on that baby is 120, then we would expect 135 at least with movement. We want to see that happen times 2 in 20 minutes. Our next one here is group beta strep, also known as GBS. This is a vaginal swab that's done on mom between 34 and 37 weeks pregnant. It is important to know that all women have this. It just looks at the amount. So she will be either GBS negative if she has a low amount or GBS positive if she has a high amount, and will be treated when she's in labor with antibiotics. So some of our non-routine testing, we have the contraction stress test. Negative is the result that we want to see. So with this, we want to induce contractions, and that can be done with Pitocin or with nipple stim with a breast pump. And that'll cause oxytocin to be released and contractions to start. So we want to have 3 contractions. So the test has to have 3 contractions induced, and we watch the fetal heart rate. We want to see the fetal heart rate just tick along and not react to this contraction. That will give us, if we have 3 contractions and the baby does not react in a bad way, and I'll show you what that means, it would be negative. So we're negative for decelerations. So if the baby's heart rate's ticking along and it reacts, it has a deceleration. So it gets stressed because of the contraction. That is called positive. So that means the baby was positive for stress reactions to the contractions. We do not want positive. We want negative. So we want that baby to do this all the way across. Our chorionic villus sampling. So this one is going to be very invasive. It is looking at genetics. What will happen is the doctor will do an ultrasound to see where the baby's positioned and get a sample from the placenta, the chorionic villus. So it's from the fetal side of the placenta, and it's going to give genetic information. This is done early, 11 to 14 weeks gestation. This mom should be educated that she should call if there is any cramping, fluid leaking, bleeding, any signs of labor or that something's wrong. Infection signs also, so a temperature, since we did put a big old needle in there. Amniocentesis. This one is also invasive and does genetics. This is with the big needle. So a wand, or the ultrasound wand, is used to detect where the baby is, and then a needle pulls up amniotic fluid. It is going to give us the genetic information. This can be done later in pregnancy. So this mom should tell us all of these, or call for all of these things, and then also if there is a decrease in fetal movement. This is sometimes a question, and you can get tricked up with the chorionic villus sampling. So just know this mom is not going to call for decreased fetal movement because she is early on in gestation. She's only 11 to 14 weeks. And so you wouldn't feel the fetal movement at that point. So education. Education will vary because of the test that's being done. So we want to make sure that the patient knows what we are looking for and why we are doing it. We want to educate her on how to prepare. Do we need her to be fasting or non-fasting, have a full bladder, non-full bladder, what to do. So just have her educated on how to prepare. Then we're going to give education on post-procedure. So this is really important. What are the signs and symptoms to watch for, and when should she call the doctor? Our nursing concepts for a patient with antepartum testing are going to be comfort. So we want to keep her comfortable. Reproduction, because we're looking at this because the mom is pregnant. And then human development, because this testing is watching for how the baby's developing and reacting inside the uterus. Our key points to remember are going to be with our lab work, or our non-invasive tests. We have lab work to look at, ultrasounds, non-stress test, glucola. So look at those, which ones are non-invasive versus our invasive that are looking at STIs, nitrazine tests, the percutaneous blood sampling, amniocentesis, chorionic villus sampling. So refer to your outline for more detail on these. And then complications, huge. So what are the complications for mom and the fetus? And they're going to vary based on what the test is. Make sure you check out the resources that are attached to this lesson and compare and contrast the various tests and education to be given. Make sure you review the outline because there's some other testing and just more details about each of the ones I talked about. Now go out and be your best selves today, and as always, happy nursing.